Hello, everyone. This is my soap note presentation. This is a patient that I had last week. So my patient was WS, date of birth 2274, age 51, Caucasian female, presents to the clinic by herself. She's a reliable historian. Her chief complaint was left foot pain for 6 months. So HPI, WS is a 51-year-old Caucasian female who presents to the clinic with a 6-month history of progressively worsening left foot pain. She describes the pain as aching and stiff, localized to the midfoot region, particularly over the dorsal aspect. She states that the pain is exacerbated by prolonged walking or standing are partially relieved with rest, ibuprofen, and Tylenol. Patient wants to try other pain relieving measures. She reports occasional swelling and stiffness in the morning lasting 10 to 15 minutes. She denies any recent trauma over the affected area. However, she had an injury to her foot while playing volleyball when she was in high school. She rates the pain as 3 over 10 at rest, increasing to 7 over 10 with activity. She denies numbness, tingling, redness, or systemic symptoms such as fever or weight loss. Past medical history, she has hypertension, diagnosed at 40 years old, no surgical history, no known food, drug, or environmental allergies. She takes losartan 50 milligram PO daily, metoprolol 25 milligram PO daily, ibuprofen 400 milligram PO every 6 hours as needed for pain, acetaminophen, Tylenol 500 milligram PO twice daily as needed for pain. She has her immunization is complete and up to date. She denies tobacco, cigarette, alcohol, and illicit drug use. She's married and lives with her husband. She's self-employed and engaged in an online business. She stays at home most of the time. She gardens and takes care of her pet dogs. Family history, her father's 80 years old, living with hypertension and osteoarthritis. Her mother's 78 years old, living with type 2 diabetes mellitus. Her brother's 45 years old, living with hypertension. She has a son, 14 years old, also living, and he is healthy. Review of system. She denies weight change, cough, fever, chills, and or fatigue. Um, Neuro review system, no numbness or tingling sensation. Musculoskeletal, she has left midfoot pain and no recent trauma. Um, Objective data, vital signs, temperature 98.3 Fahrenheit, heart rate 78 beats per minute, respiratory rate 16 breaths per minute, blood pressure of 123 over 76 millimeter mercury, SpO2 of 99%, pain of 3 over 10 over the left foot, weight of 145 pounds, height 62 inches, and a BMI of 26.5. Uh, Physical assessment or physical exam, neurovascular, her sensation and peripheral circulations are intact. Cardio is 1 is 2 heart sounds on auscultation, no murmurs or clicks. Thorax and lungs, not in respiratory distress. Bilateral clear breath sounds on auscultation, no wheezing, crackles, or rhonchi. Musculoskeletal, mild swelling over the dorsal midfoot of the left foot, no erythema or bruising, positive tenderness over the first and second tarso-metatarsal joints or TMT, no warmth or crepitus. Um, there's a decrease in ROM with dorsiflexion and plantar flexion at the midfoot. Also painful with stress maneuvers. And I also notice slight antalgic gait on the left side. So my differential diagnosis, left tarso-metatarsal or TMT joint osteoarthritis. That's our number one differential. as evidenced by pain and swelling over the dorsal midfoot of the left foot. Number two is less frank injury of the left foot. It's possible, but less likely due to, or normally midfoot pain is associated with low to high energy trauma of the midfoot and TMT joints and ligaments. That's kind of like the typical sign of less frank injury. Another consideration is left plantar fasciitis. It's possible but less likely due to pain is typically over the plantar aspect or over the heel. And lastly, left talar neck fracture. It's also possible but less likely due to pain is typically over the left hind foot and associated with bruising and swelling. So our main diagnosis is a left tarsometatarsal joint osteoarthritis. So plan. We did X-ray during the visit, and X-ray of the left foot showed degenerative changes at the first and second TMT joints with joint space narrowing, osteophyte formation, and subchondral sclerosis. Our treatment, so basically she can continue with her hypertension medication. She can continue using ibuprofen 400 milligrams every 6 hours as needed. She can increase her acetaminophen to 1 gram orally twice daily as needed for pain. She can also use diclofenac gel once daily as needed for pain. And actually in the visit, we did intra-articular steroid injection to the TMT joints using the triamcinolone and bupivacaine. Education, rise, rest, immobilize, cold compress, and elevate affected area. Wear custom orthotics with medial arch support and step sole. Minimize, if not avoid, putting weight on the affected foot. Avoid activities that cause stress to the TMT joint, such as jumping. Referral to physical therapy for strengthening and mobility. Exercise to reduce midfoot stress. And follow-up, she needs to follow up in the clinic after 3 months to assess pain control and functional improvement, or follow up sooner if symptoms persist or worsen. And at that time, we will consider imaging such as MRI or referral to orthopedics. And I welcome your feedback. Thank you.